I can tell you, reducing maternal mortality and also infant mortality is perhaps one of the biggest public health challenges. Now, in order to help us collectively to get good results, we must have evidence, we must have information. By that I mean you know the size of the problem. And without that, you cannot even begin. So those statistics of 9.7 million children killed, every year, what about women? So if you ask me, how can we make significant improvement in improving maternal and child health? Please address gender inequality. Educate women.
In Norway, it's 1 woman per 30,000 birth dies. In Afghanistan and some other countries, it's 1 in 7. It's something of the most dangerous thing women can do is to give birth. So, and it doesn't improve.
A common denominator for all those causes of death is lack of access to health care.
Just consider a woman who's poor, who's powerless, and pregnant. And she has no political voice.
Children have no political voice. They don't vote, they don't kill, they don't use AK-47, they don't create riots, they can't even write a letter to editor. They can't protest. And so child death just doesn't matter. Child can only cry and then child can die.
A program that we had in Peru, we were able to reduce maternal mortality by almost 50%, 49%, in a project that really just worked with communities, developed the infrastructure, trained healthcare workers, made sure that women had access to services and that they knew how to access the services and felt empowered to do that. We were able to bring down maternal mortality by 49%.
The mental blocks. The mental barriers of the medical community and policy makers. How can an ordinary woman be trained to provide medical care? If we get over those mental blocks, all these medical care benefits can flow to developing country villages. Small shoulder bag in which she has all her equipments which cost $60. With that shoulder bag and $60 equipment and training, she can turn every home and hut in developing country into newborn care ICU.
Human ingenuity. We need to be creative and need to know the situation on the ground, support the countries know best. And Africa alone, we need more than 4 million doctors. You just tell me, how long does it take to train 4 million doctors? And by the time you train them, you don't provide an enabling environment for them to do their work. And there's no wonder why they migrate. And then we really need to break this vicious circle.
We know by just shifting the focus a little bit and allocating existing resources and receiving through public-private partnerships and people gathering together additional resources, that we can literally have an impact that is measurable, that is real, that is discrete, with really pretty low technology